with Keith Rakowski, Senior Benefits Specialist at A&B Financial, and we're going to get to know him a little bit better today. So let's jump in with a few easy questions. How long have you been at A&B, and what brought you here in the first place?
Well, I've been with A&B since March of 2011, I believe. And what brought me here was I was with another agency.
Okay.
Now, the agencies often that you go with, their one claim is that you're in business for yourself, but you're not in business by yourself. And that's basically the way it is. But what brought me and what attracted me to A&B Insurance is the administrative support.
Okay.
That you get here, and the support that is demonstrated by the trainings.
Mm-hmm.
Okay, whenever there's a training, whenever there's something to be offered, they always offer trainings, and it's up to you whether or not you want to take part. You want to have it as part of your portfolio. And with that, also, whereas many other agencies don't provide you with the funds to join various networking groups,
Mm-hmm.
A&B Insurance, as long as you prove that it's a substantial group, that it's something that's going
Sure.
to benefit both yourself, help you grow, and help the agency grow, they'll be more than happy to support you. And that's part of why I'm here.
That's great. I mean, that makes perfect sense. And do you think that the training and the education and all the things you talk about, how does that benefits the client in the end, doesn't it? They get more informed, everybody's up to date in terms of the agent they're working with?
It benefits the client, and it also benefits me.
Okay.
It makes it a lot easier. When someone's asking a question, I don't have to go fishing around, running around, looking for the answers. I have everything at my fingertips.
Mm-hmm.
It's all provided. All I have to do is put it on my desktop. It's right there. I can open it up and answer questions for my clients. If not, we call our advocate at Blue Cross and Blue Shield,
Right.
and she looks for all the information. Either she gives it to you right there and then, or she does follow up with emails so that I could satisfy anybody's questions that they may have.
And that's probably now more important than ever with healthcare reform and all of the changes, really to be up to date and educated. And, I mean, because questions are coming out of left field now, I'm sure, aren't they? I mean, just things you've never heard of before.
Absolutely. Absolutely. And the biggest question is, how much is this going to cost me?
How do you answer?
It depends upon your income. It'll be based upon your income. And that's what I try to explain to them. And I generalize about the income and the different areas, and I use hypothetical situations.
Okay.
Of course, there are certain groups. There's the 4 groups in healthcare reform: the bronze, the silver, the gold, and the platinum. And I explain some of that to the customer or prospect or client.
Mm-hmm.
And I will often go over and sit down with them if I know them, or I would give them a call back and we go over it in detail. We can do a join me where they're actually on my desktop, and I could open up the files right in front of them and show it to them and explain exactly what's going on, and they see how the subsidy is going to benefit them. If they qualify for a subsidy, that subsidy is going to apply regardless of the premium that they decide upon.
Yeah.
So
Right.
With that, I hope that answers your question.
Sure. Yeah. No. I mean, it's understandable that would be a very popular question.
Absolutely.
And still, I think without knowing what the plans are going to cost, with that, you really don't have the full package to give somebody yet.
Exactly.
I think we heard at the seminar a couple weeks ago that'll be coming out either next month or it's got to come out. The month
Absolutely.
after
Well,
that,
it'll be
right?
out in September.
Yeah.
But I don't tell people that it'll be available in September, because if it's coming out in September, I'll have to figure it out,
Sure.
or it'll have to be. We'll go over it to make sure that everybody has it, so that they're so comfortable with it.
That they're not giving out misinformation.
Exactly.
Right.
Exactly. And they know where to turn if they do have some sort of complicated question. Because everything is generalized, and of course, everybody has their own idiosyncrasies and the various aspects of their life, as usual.
Absolutely.
You know?
Well, I think if anybody's going to be up to date and up to speed, it'll be you, Keith. Thanks for joining us
Thank
today.
you.
I appreciate it. And what's the best way to get a hold of you? Phone number, email? What's your?
Well, my phone number is the best one.
Okay.
That's my cell phone number, and that one is 727-542-8181.
Okay.
And and I leave that on all the time. And if I don't answer, it's because I'm speaking with someone.
Great. And all of Keith's, the rest of his digital contact information will be right here on the profile. So he's looking forward to hearing from you, and you should look
Absolutely.
forward to hearing from him. And thanks again, and catch us next time. Thanks.
Thank you.